Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue to talk about hypertension and update. When I left off last week, I gave a whole different explanations about all the problems that had related to hypertension. I will repeat some of the statistics. Worldwide, there's 1.5 billion people who suffer from hypertension. In this country, 103 million people suffer from hypertension. One out of every three American adults suffer from hypertension. In the Negro slash African American community, one out of every two adults suffer from hypertension. Very, very common problem. Worldwide, one out of every four male suffer from hypertension. One out of every 5 to 6 women suffer from hypertension. Why is hypertension so bad? It's so bad because once the pressure is elevated, it affects the high flow system slash the arterial system. It's inevitable. Once one suffers from hypertension, eventually you're going to have some chronic medical problem associated with the hypertension. The better you control the hypertension, the less likely those problems will develop soon, but sooner or later something is going to happen. What are the problems that hypertension causes? Well, it could damage the brain, for one thing, it can cause a stroke, either ischemic stroke or hemorrhagic stroke, and or it can affect the eye as well. Once the eye is affected, it increases the risk of glaucoma. It can affect the carotid arteries, left and right, that carries blood to the brain, resulting in plaques that can narrow the vessel, that can cause problems. Then it can affect the heart in many different ways. One of the things that it can do to the heart is because the pressure is so high, the heart has to pump harder in order to push the blood throughout the rest of the body. And the constant pumping of the heart against the resistance, i.e., which is the elevated pressure, the muscles of the heart becomes enlarged. That then can cause a long list of problems. The enlargement of the heart, which is the hypertrophy of the heart, can cause, of course, congestive heart failure, which then can lead to all sorts of different type of cardiac rhythm abnormalities, i.e. arrhythmias. And of course, in addition to that, since the heart is enlarged, it can't pump very well. And once the heart pumping ability decreases, then the kidneys cannot be perfused properly because the heart has to pump the blood to perfuse the entire body. And of course, the kidney is part of the end-stage organs, such as the end-stage organs are the brain, the eyes, the heart, and the kidney. So that's the perfusion aspect of it is one thing. I'm going to detail for you what the elevated pressure does to arteries in particular. So this way you have a clear understanding how the elevated pressure manages to damage blood vessels. Let's take the example of the high flow system, i.e. the arterial system. The inside of these vessels, no matter the caliber of the vessel, is supposed to be as smooth as silk. Nothing can interfere with the blood when the blood is passing through. Very nice and smooth. What happens here, the ischemia begins to develop, is the fact that the pressure is high, higher than normal. Nothing else yet. The very fact that the pressure is higher than normal, that itself causes damage to occur in the first lining of the blood vessel called the intima. Heretofore, it was nice and smooth. Things were going through, because you have to understand, tons, literally, tons of debris that must pass through the vessel to be carried out to the liver, to do this, to do that, to get rid of it through the urine or through the feces and so on and so forth. Once the first little damage, which is caused by the elevated pressure itself, nothing else yet, just the fact that the pressure is higher than normal inside the vessel. Because when the pressure is high, it is inside the vessel. When you take the blood pressure of the individual, the elevated pressure is reflecting how high the pressure is inside the blood vessel. That itself causes the first little aberration to occur inside the blood vessel. So far, so good. Okay. I just mentioned debris that's passing through. As the damage occurs, for the first little damage, no matter how tiny it is, as the debris is passing through, one little debris is going to get stuck in that little damaged area. Heretofore, it was nice and smooth, and it stick there. That is read, believe it or not, by that surface of the vessel as a foreign substance. That then causes the beginning of a local inflammatory process. I want you to visualize that. That local inflammatory process begins, and then there's an inflammation right there. And as the inflammation progresses, more little garbage gets stuck on top of it. That begins, here it is, that begins the formation of plaques inside the blood vessel, no matter the caliber of the vessel. The vessel could be the aorta, either the thoracic or the aorta or the abdominal aorta, which is the two largest. The aorta is the largest blood vessel in the body. Yeah, you form plaques there too. You could develop aneurysm because of the plaque. It can rupture, unfortunately. And all vessels, in particular in the arterial system, all these things can be affected by the elevated pressure because it was not meant to be that way. I've talked about the causation of pressure. I'm not going back there again. I'm just talking about what's going on in reality in someone who is hypertensive. And the organs, all organs will ultimately suffer secondarily as a result of blood pressure. But the primary organs are the ones that I'm talking about. So, you develop ischemia. How did the ischemia develop? Well, the development of the ischemia is the fact that the blood is not passing through freely. It's getting stuck there. Therefore, oxygen is not being delivered properly in the area that that vessel is responsible for. Each vessel is responsible for a little part of the tissue where it is located to bring in oxygen, to bring blood. And the blood, of course, has oxygen. The oxygen is located in the hemoglobin that is part of the red blood cell to deliver it, because no tissue in the human body can survive for any significant period of time without the delivery of blood to it to keep it alive. So since we're starting about the brain, well, once that happens, let's say in the larger caliber vessels of the brain, then of course that can cause ischemic stroke. There are different types of stroke. You have ischemic stroke, you got hemorrhagic stroke, you got thrombotic stroke, and so on and so forth. If the pressure is super, super high, like Stage 4, which is hypertensive crisis, the vessel, when not in good shape to begin with, you could rupture a vessel and have hemorrhagic stroke right there, period, because the pressure is too high. If the pressure is high chronically, then you could develop you would inevitably, if it's does not get treated properly or not treated at all, you will eventually develop damage to the brain and all the other end stage organs, the brain, the eye, the heart, the kidney. I'm sticking with the brain because I'm starting from the top. Now, deep into the substance of the brain requires blood flow as well. Otherwise, that part of the brain wouldn't survive. The tiniest little arteriole, no matter how tiny they follow the same process. Vessels are vessels. They have different caliber and sizes, but the same physiological concept exists. That is why the vast majority, more than 95% of individuals of color who develop dementia, they don't have Alzheimer's. They develop dementia because of microvascular disease of the brain. Microvascular disease of the brain. The chapter on stroke in this book, I believe it's chapter 2, African American Women's Health, and also the art and practice of modern clinical medicine, chapter 2, is also on stroke. I describe these things in the greatest possible details. If you need to know more about these things, get your hand on these books, read the detail, the time and effort that I took to explain all these things. Therefore then, now you understand when an older individual is showing sign of memory issues, it not necessarily mean it's going to be because of Alzheimer's. It's about maybe 5.5 million people in this country who have Alzheimer's, but several times more, that number, has dementia. One of the most common causes of dementia happens to be problem associated with microvascular disease of the brain. And there are so many different causes. It's not just the blood pressure. Elevated pressure, high cholesterol, diabetes mellitus, thrombophilias, and a whole host of other abnormalities can cause someone to have microvascular disease of the brain. And those tiniest little vessels deep into the substance of the brain are not able to carry sufficient blood to literally perfuse that deep inside the brain. So you wind up with dementia. Now you understand. Yes, Alzheimer's is a horrible disease. Lots of folks get affected, several million, as I said, 5, close to 6 million now. But there are many more millions that are affected with dementia having nothing to do with Alzheimer's. There's a long chapter on Alzheimer's disease in this book, a long chapter on microvascular disease in this book. I talk about this stuff in the greatest detail. So now you understand how important it is for one's blood pressure to be well controlled. Unfortunately, we have 1.3 million people who suffer from hypertension. Somewhere around, I would say, 55% or so, according to the literature, having the blood pressure somewhat controlled. What happened to the 45%? This is a country of 3.29 million people. This is the general statement. Well, you have in the Negro/American community, and I use the word Negro for a particular physiological reason. because all individuals of color who are not Caucasian have reason to listen carefully to this discussion, because the way you treat them for blood pressure is 100% different than the way you treat Caucasian individuals. That's creating a problem itself. So for those people who actually go for care, and the vast majority of folks of color in this country are not going for care for their blood pressure. And if they do, few of them, frankly, are getting the proper care for the blood pressure. Because for reasons that are very baffling to me and others in the academic world, for a reason that is absolutely unclear, why is it that these folks don't know how to treat blood pressure? They don't treat blood pressure in men. They don't know how to treat blood pressure in women. That's why you have tremendous problem with women that are pregnant. They develop preeclampsia, eclampsia. One of the major problems is elevated pressure that are not being treated properly. And the people who are supposed to ask for help to get these ladies treated properly while they're pregnant, not asking for the help. And you have, of all the developed countries in the world, you have more morbidity during delivery of babies in this country than any other developed country. More women die in this country after they deliver a baby than any other developed country in the world. And the list of things, of course, hypertension is one of them, bleeding is another, clotting problem is another. They deliver a baby, and a day later, they die without even seeing the baby for the first time because they clot. They clot because they have a thrombophilia that were never known to the people caring for them, period. And when a lady is pregnant, in order to maintain the pregnancy properly, she needs the highest level of estrogen possible. Where the higher the level of estrogen superimposed on the thrombophilia, the higher likelihood of a clot occurring. It's a given. It's going to happen. You can't tell me in 2019 in this great country, internet all over the place, lectures are being given all over the place. I do not have a monopoly on all this stuff that I'm telling you about. This is out there. I'm teaching it. I can't invent stuff to teach it. This is the science. This is the up-to-date. This book, The Art and Practice of Modern Clinical Medicine, the title tells you what's going on. It's all there. 850 practicing physicians across the world, across this country. Most of them flat out brilliant people, intelligent, brilliant people. I wouldn't dare make a single statement that is not truthful, ethically and professionally. It's all I'm telling you is the truth, okay? Those are unnecessary deaths that are occurring. People are bleeding, exsanguinating, dying because so many women have bleeding abnormalities, i.e. Van Willebrand disease. Nobody knew anything about it. You can't tell me you have 77 million people with a bleeding abnormality such as Van Willebrand disease out there, and 3.2 or 5 million folks in this country have Van Willebrand, and these women are bleeding, and you don't test them for Van Willebrand? Give me a break. And God forbid you showed up in the emergency room with a headache, a pain in your knees. The first thing you're given is 2 baby aspirin. Yeah, I'm sorry, 2 aspirin. Take 2 aspirin. One of my colleagues made me laugh so much I could cry that he showed up he was doing some work on his house. He felt something, it damaged his hand. He knew he fractured a hand. You can feel it. Showed up in an emergency room that I will not obviously name for the obvious reason. His vital sign was taken, All the man showed up for was to get an X-ray. He's an radiologist himself, but he can't X-ray himself. He just wanted an X-ray of his hand so that he could get orthopedic care. He was given 2 aspirin and a bottle of saline. So he said, "No, I don't need any aspirin. Why are you giving me saline for? All I need is an X-ray." So he got to sign it. "Sir, you accept the care. That's what we want to do." But you're going to give him 2 aspirin. Suppose he had von Willebrand disease. He's going to exsanguinate. Another sum. I mean, I know I'm talking about hypertension. Let me give you another example. 25%. This is a true story. 25% of adult hemophilia develop spontaneously. Spontaneously. People develop hemophilias that they were scheduled to have. Several patients in my office that I'm preparing to go to send for surgery, they have hemophilia and they know nothing about it. And you can give them 2 baby aspirin, which is contraindicated. And if I argue against it, then I'm not only that I'm a bad person, I must be destroyed. Forget about the fact that they're not interested in learning from me. Oh, God forbid they're going to learn medicine from a Negro man. Oh, my God. Whew. That's a catastrophe in itself. Okay? They're not interested in learning. In fact, I get offended if I take time to explain to them. They're not interested. Okay? They'll go to the Caribbean, butt themselves a diploma, and then come here and try to compete with me. Oh my God. It is sad. In any event, you got some excellent physicians that are doing great job 24/7, but some of them, oh my God, forget about it. In any event, so their blood pressure, therefore, then must be controlled. You can't control the blood pressure for a patient if you're not familiar with and sensitive to the patient culture and the physiology. Not every patient has the same physiology. Not every ethnic group have the same physiology. There are major differences. And you have to take it is a lot of time, it's a lot of work, but it is your job to know this stuff and to take the time to do it proper. If the patient says no, then write the note on the chart. I offer the patient X medication because X medication is better. He or she says no. No, that's fine. At least you show that you know what you're doing and you cover it. Because the patient says no, you write the note, patient refuse. Then you could say goodbye to the patient, send he or she a letter and say, "I no longer wish to take care of you," which I've done many times in my career. But you can't justify giving somebody a prescription for medication when you know very well it is not appropriate for that. How can you tell me? I'm a Negro person. If I show up in your office with hypertension, you're going to give me an ACE? How are you going to give me an ACE for? I don't have enough renin in my bloodstream for the ACE to block, to lower the blood pressure. You're going to give me an ACE? Give me a break. How are you going to do that? How can you justify? How can you live with yourself if you do something like that? Unfortunately, it's being done all the time. So therefore then, part of the problem is that patients are not being treated properly and or they're not going to the doctor. You can't blame the doctor if the patient don't come. And the patient don't come sometimes not because they don't want to, it's because they don't have the money. They're busy. They're working 2-3 jobs. I used to work 3 jobs. I worked 3 jobs when I went to college. Okay? I'm not talking about anything that I don't experience myself. So a lot of the time, the patients can't take the time. That's one of the main reasons when I wrote the article recommending the formation of community health centers in the United States of America. That's one of the points that I made. I said in the article, the best way to bring health care to the ghetto poor. I said that in the article. If you did not know who wrote the article that recommending the formation of community health center that provide care for 26 million people, now you just found out. And I use the word how best to deliver health care to the Negro, to the ghetto poor. I use the word ghetto poor. That's what I use. And you could check that article on PubMed. So it is very important that you do the right thing, because you have to understand something in the practice of medicine. Patient give you one chance. One chance. And if you messed up that one chance, you may never see the patient again to correct what you've done that wasn't quite good. You may never get that second chance. So be thorough of what you do. I'm not pontificating. I'm just telling you the way I do it. That's your problem, the way you do it. But I can't fault the doctors. I'm not faulting doctors. I'm just telling you the reality is that you look at the literature. The vast majority of African American folks don't go for medical care. And if they do, they don't always do what you tell them to do. The women are much better in terms of following medical advice than the men do. That's why the subgroup with the highest incidence of congestive heart failure in this country is African American male between the ages of 35 to 40, thereabout. Because the heart is under constant stress, it's over pumping, the blood pressure is not controlled, and the stress the heart is feeling, causing the heart to become enlarged, and it fails. This stuff is crucial. And then what's sad about it, the simplest diagnosis to make is elevated blood pressure. The simplest disease to treat is hypertension. There are thousands of very highly complicated diseases that one have to deal with. The simplest, the easiest to diagnose is hypertension, and the easiest to treat is hypertension. Yes, there are complications with dietary this and weight, obesity. Yes, but there are ways of managing these things so long as the patient agrees to follow advice, agrees to take the medication properly, and the patient must be given the right medication based on his or her ethnicity. You will not discriminate against anyone, nor should you ever discriminate against anyone, but you should take into account who they are, not to discriminate against them, the contrary, to provide better quality care for them. That's correct. That's the reason why you're supposed to know this stuff, so that you can provide the best quality care for this particular patient based on his problems and association with who the patient is. That's very important. Can't treat somebody if you don't know who they are. You just cannot do it properly. You could do it, but it's not going to be done well. Listen, until I see you again, this is Dr. Alcena saying so long and bye-bye.